Dr. Owens, thanks so much for being with me today.
My pleasure.
Can you tell me a little bit about how you use big data in your work?
At our centers do health policy. We look at policies from cradle to grave, both domestically and internationally, and use all types of data. Demographic data, data on healthcare utilization, data on the effectiveness of interventions, and increasingly we certainly hope to use genomic and other kinds of data. And we use those data to understand the determinants of health and how policies might improve health.
That's quite a broad scope.
It is a broad scope, and that's one of the things we like about it. We actually take a very broad view of health because the way we're situated here at Stanford University, we can look at health and the determinants, health economics, political science and health, law and health, and it's a great way to allow us to think very broadly about how we can improve health.
So you kind of work on the back end, is given this data, how can we improve health? How are we going to get this data from everyone? From, you said, cradle to grave. Do you think in the future people are going to be much more monitored? We're going to be able to collect more data?
Well, that depends a bit on what people want. In some countries, people already are more monitored and have data from cradle to grave.
Like Sweden, for example.
Exactly.
Sure.
That's just what I was thinking of. Whether people do that here is unknown at this point. But there is already a great deal of data that's being collected on people, and often people are willing to let that data be analyzed. And we think that's going to improve the ways that we understand what improves people's health and how we can get better policies to improve people's health.
Can you give me an example of how this has already worked so far? Is there an instance that you can think of where big data has actually changed the way that we practice healthcare or a health outcome?
Well, increasingly we're learning about the genomic information that people have, what their genomes look like. And it's sort of early days now, but we're still trying to map that to the clinical outcomes that people have, and that's what many of the programs like the Million Veteran Program are trying to do. And so I think that as those programs come to fruition, we'll then begin to see some of the benefits of this work.
So in some ways, we haven't been able to reap the fruits of this labor yet.
Well,
clinically.
I think we're beginning to, and but we're still in the early days.
Is there anything in particular that you're passionate about, a question that you would really, really like to see data being used to help solve?
We have many questions that we're passionate about. We're interested in how the population health can be improved, what's likely to happen as people get older. So, for example, one of our projects is called the Future Elderly Model, where we try to predict what's going to happen as people age in a population. We're doing that both in the United States and in Japan and other countries. And that's being led by Jay Bhattacharya and his colleagues. And it gives us a way of trying to understand what are the healthcare needs likely to be, and what are the things that you might contemplate doing now that would help improve the health of the population as it ages.
Can you give us an example of one of those determinants or solutions?
Well, sure, certainly the rising rates of obesity are an issue. And how that affects the disability of future generations is going to be a very important question.
You're a physician. What got you interested in the more global outlook, this kind of 300-foot view of health?
We think that we can have influence on a lot of people by examining the policies that might improve health. And so while we get great satisfaction from taking care of people and improving people's health one person at a time, improving the health of entire populations is going to require things in addition to that. And so we think you might be able to intervene upstream, for example, in childhood, or with healthy behaviors that make a very big difference in populations broadly.
A lot of physicians might practice what would be described as anecdotal medicine. They don't use data, they go based on their experience. How can you use data to convince physicians that they should maybe take a broader view of their patient's health?
One of the things that we do is help develop clinical guidelines for care. So those guidelines are based on a very careful review of evidence. And we believe that that's one way to help clinicians capitalize on the evidence that is available. It's a very labor-intensive process, but the guidelines can help them understand what best policies are on the best science that we have available.
Dr. Owens, thank you so much for joining me today.
It's been my pleasure. Thank you.